Hello, welcome back. Now, you remember these scenes, police having to break up queues of people who had waited hours, some of them before sunrise, to register at a new NHS dentist in Bristol. They were desperate to sign up and get an NHS appointment, with some resorting to DIY dentistry. Well, the government has reacted, finally publishing a long-awaited dentistry recovery plan. But is what's in it going to make enough of a difference? And is there any faith that this crisis, which, let's face it, has been brewing for some years in dentistry, can finally be solved? Well, with me in the studio tonight, Dr. Kunal Patel, a dentist who owns a mix of NHS and private practices, and joining us from Bristol, Norman Stevenson, a teacher who is in such dire need of dental care, he's been forced to take some pretty drastic measures. Good evening to you both. Dr. Patel, I mean, Norman here is gluing his dentures back together. You run a mixture of clinics that take private patients and NHS patients. Yeah. What is the situation at the moment? Why can't people like Norman get an NHS appointment?
And I think, first thing, Norman, sorry to hear that, but the first thing you must know, as a professional, as a dentist, the reception staff, the team, the dentist, we want to help patients like Norman.
Because you're getting a bit of a bad rap at the moment.
We
don't think that's fair?
I don't think it's fair, because I don't think patients or the public realise it's not the clinic's choice not to provide NHS treatment. If we're an NHS practice, we have a certain quota that we can only see a certain number of patients in. If we reach that quota, to see someone like Norman, what I would have to do is call up an existing patient of mine and say, Mrs. X, do you mind not being a patient at my clinic anymore?
So you bump them off the list to get someone else on?
We would have to, because there's literally no quota to see a patient like Norman.
So essentially, the government says to you, OK, you can be an NHS practice, but we are only going to fund you to see 200 NHS patients.
It's similar. It's done in units of activity, but yes.
But essentially, that's it.
Yes.
OK, so you've opened these new clinics and you've applied for another contract, another quota, and what's been the response?
So we have 2 NHS clinics, Love Teeth, the original ones, and then we've opened 4 more. One is a kids-only dedicated clinic. So we thought, doing something really good for the community and the public. There's a huge crisis in kids.
Tooth decay is the #1 reason a child over 5 will end up in hospital.
Yes,
and it's a big problem.
And I have a child who's 5, so it was one of them parts when my child comes to me and says, Dad, which clinic do I get to go to? And I said, you pick from any of the Love Teeths. And he goes, no, they're for adults. I want a kids only. So I thought, OK, let's serve a purpose. Let's educate the population.
What help did you get from the government for that kids clinic? Nothing at all?
Nothing at all. And on top of it, we get a hard time because patients turn up thinking we're choosing not to see them on the NHS. So we've actually had to take things, and I'm not the only dentist that does this, but we offer adults £20 checkups, which are actually cheaper than the NHS, and we offer kids £5 a month to be seen.
So you're trying to do your bit, but essentially you want to provide NHS appointments, but the government are saying they haven't got the funding for you. Norman, Dr. Patel in the studio. Dr. Patel, before we went on air, you were saying, I said, you know, those scenes in Bristol, and you said, look, if I announced I had more NHS appointments, I'd be seeing scenes like that outside my surgery.
I think it would happen in majority of the towns across the UK. I think we announced that we're accepting NHS patients and we have a huge quota. There'll be queues again. And I think I've been a dentist for 14 years in the NHS. I do have to say it's good to see the government finally addressing and knowing there's a crisis. But this scheme, I don't think it's even going to scratch the surface. Yeah,
let's talk about the government's plans, because they've announced this dental recovery plan. One-off £20,000 payments for dentists working in underserved areas, a new £15 patient premium for dentists seeing patients who haven't had a checkup in 2 years, £50 premium if they need significant work, and there's a new minimum unit of dental activity value of £28, which is up from around £25. People are saying the problem with that, the British Dental Association are saying the problem with that is that, yes, it's an extra £200 million earmarked to fund that plan, but in real terms, NHS spending on dentistry is down by £1 billion since 2010. More than 1,000 dentists have stopped working for the NHS since the start of the pandemic.
Yeah, it's been something that we've been talking about a long time. I was on the news during the pandemic trying to get us open and ask for more funding, because the problem we have is that the dentists are there. We want to work, we want to help. Unfortunately, for example, the things that the new government have come out with, the minimum for a unit of activity, that's good. that will help certain areas. I think that's right. I think these little areas that they're putting funding into, that's great. But majority, this £15 to £50 thing that seems like it's something that's going to be really helpful, they're not adding that to our contract values. For example, as a dental practice, I have a set quota, and what they're asking us to do is favour new patients that haven't been to the practice for over 2 years or anywhere over my existing patients. They're not adding to the contract.
So, again, it would be someone being bumped off the list and not having an NHS dentist.
And I think a lot of us dentists sat there yesterday and the day before trying to figure this out and say, is this right? Is this what they're encouraging us to see? There are certain practices that have very large contracts. Maybe it's making it easier for them to fulfil their contract.
OK.
It's not helping.
What is going to help? Because, you know, I'm talking to people like Norman, who is a performer, who is saying, you know, he needs his lovely smile to perform. And, you know, recruitment agencies are saying that bad teeth are an under-acknowledged reason that job hunters from disadvantaged backgrounds and postcodes get turned down for work. Has massive mental health implications. People don't want to show their teeth. They don't want to smile. It's isolating. There's a massive impact here, not just the physical pain. What can be done to help?
I think two things, OK? I think the way the NHS dentistry is carried out in the UK needs to be transformed. The way we deliver it as dentists to make it more feasible, financially feasible and in the patient's best interest. Number two, the government have to give the funding back into NHS dentistry. They've taken it out for many years. Bring it back in. We are a developed country in the UK. We're not behaving like a developed country in the way we're treating our patients in dentistry.
Apparently, access to public-funded dentistry is worse than in Ukraine or Rwanda. That comes from the Economic Impact Health Inclusivity Index. What about when people say the dentists are coining it in through private work? That's why they don't want to work in the NHS. It's more lucrative to go and do it privately.
And yes, I understand why, because for me, for example, I've got a set of clinics. The private clinics that I have, even though we wanted NHS to help the community, do support the NHS dental practices I have. Because you can do 7 fillings or you can do 1 filling and the dentist will be remunerated in the same way. OK,
Dr Patel, I just want to give a final word to Norman and that smile that looks great at the moment down to your DIY dentistry, but just imagine how great it's going to look at the end of March. Just a final word for anyone out there who is suffering like you, Norman. What's your message to them in terms of keep persevering, keep hunting out that dentist? What would you say?
I say take up your own DIY. Yeah, look, I'm going to say this. It's not the first time I've done DIY. I've had to pull my own teeth out as well because it takes so long.
No.
Yeah,
Norman, I hate to hear this. I hate to hear this. Dr Patel, advice for people like Norman who are going DIY. What can they do? Because this is serious.
It takes so long.
I think look around, because some dental practices will offer at least an examination for £20 or so, because tooth decay doesn't go away once it hits a certain point. We can't ignore it. At least get it screened and looked at.
All right, Dr Patel, thank you. And Norman Stevenson, thank you.